It looks like we're basically live here.
Jim, we're live, your host, and I'll stay on for a second and then you're good to go.
Well, thank you, sir. I appreciate it. So we'll go ahead and kick on the webinar here. It's 6 o'clock. It's time to go. So let's get this baby going here. So.
Okay.
Well, hello, and thank you for coming today. And thank you guys for coming. I truly appreciate it. I'm looking forward to this panel because I am of an age that this is very pertinent to me at the moment. I need to know these things. So it's this one is about Medicare. We have open enrollment coming up. Is it what, next month, right? In about another few days.
October 15th. Yep.
Weeks.
Okay, October 15th. Okay.
Yep.
So basically I want to hear from the experts on Medicare and what we should be knowing about it and what questions we should be asking and stuff. So we have a really good panel here today. And we also would like to have you put your prayers out for two other panelists that have family emergencies going on right now that literally just at the last minute couldn't be here, but they got to take care of what they got to take care of. So let me just go ahead and have you guys introduce yourselves, who you are, what you do, name of your company, all that kind of stuff. Colleen, let's start with you.
Hi, my name is Colleen Page, and I work for a company called AMBA. We are endorsed by the Indiana Retired Teachers Association and the Retired Indiana Public Employees, and we do the senior benefits for them. So I do a lot of Medicare because most of those people are retired and getting ready to get on Medicare or already on Medicare or need to know what, we try to make sure that they're always on the best plan. So that's what I do.
Excellent. Bruce, tell me about you and who you are and what you do.
Yeah, again, my name is Bruce Muller and I'm with SHIP, the State Health Insurance Assistance Program. And we are a program that is funded by the Centers for Medicare and Medicaid. And we are essentially your local help for Medicare. Every state has a SHIP program. We are staffed by volunteers who go through a rigorous training program, and we don't sell anything. We're here to help people understand their Medicare. And it's a difficult choice. People sometimes ask me, why did it become so complicated? My comeback is, how did the IRS become 90,000 pages? So that settles the argument on that. But again, we are part of a nationwide program. We are sponsored by the Indiana Department of Insurance, have various sites around the city and the state. We have about 400 paid staff through some of the agencies such as SECOA, and then plus volunteers. And we're here to help people, especially during the open enrollment, but all year long, because there are questions as people retire. And we try to take the confusion out of it and, help them understand how to take their benefits.
Well, very good. Mona, would you like to talk about who you are and what you do? So.
Hi, everyone. My name is Mona Euler. I'm the founder of A Healthcare Advocate. I am a registered nurse, and I'm also an independent licensed agent. I specialize in Medicare Advantage, supplement, and long-term care plans. And my goal is to educate people as well about Medicare, the choices, and what can be offered. So I do offer those plans, but I also spend a lot of time educating them. And sometimes they don't make a plan change. And a lot of times I find they don't even understand their coverage. And there's some things that they need to utilize. So it's a really good feeling when you're explaining their insurance to them that they've had for a long time and they haven't got some of the benefits out of those plans that they really desperately need. And so that's one of the benefits of what I can do is explain what they currently have, look at different options, really try to understand their clinical needs, and then put that all together with recommendations that they can make the choices themselves, the pros and cons of each plan.
Excellent. I am so excited about having this panel because I have had to deal with different family members that, every year this comes up and you look at it and you might as well be looking at, I don't know, Chinese. It doesn't make any sense. I don't have, you kind of going, okay, well, it looks like it worked last year, so let's just stick it with this year. That's probably not the best plan, is it? Or do you agree that there'd be a better way of doing that? Or so I'll let you guys kind of tell me about what they're coming up. You're getting these packets in the mail today. I just saw my uncle's yesterday. Okay, that it just came. What should someone do? What should they look for? I mean, obviously, probably call you, but but tell me what the why you should look at maybe a different plan than what you're on, or how's this whole thing? It's too confusing for most of us.
Jim, let me just give you an example of what can happen. At our site in Bloomington, a lady came in, and because a doctor had said he knew about us and came into our counselor, and she was paying $30,000 out of pocket on for her drugs. The good news is she had the financial wherewithal to do it. The bad news is she had the financial wherewithal to do it, so she never questioned it, just figured, oh, this is the way life is. Well, our counselor, a volunteer, went through it all, and the bottom line is, got a drug plan that had her drug in it and saved her about $31,000. So there's an example. I mean, obviously, it doesn't always happen to be that amount of money, but for many people, any amount of money that you can save, if that's the case, is important.
Well,
And
that kind of
like Mona
$31,000
said
a year would
too,
add up.
pardon me?
I said $31,000 a year would add up.
Yeah,
Oh
like
my
I said,
goodness. Yeah.
like I said, the good news is she had the wherewithal, the financial wherewithal. The bad news is she had that and just assume, this is normal life. And just to add to that, that was a volunteer that did it. So now she will be a volunteer until she can't do it anymore, because
Yeah,
once you help somebody do
She's
that.
hooked.
Jim, everybody should look at their plan at least once a year. And
Right.
preferably, before open enrollment, if they have a Medicare Advantage plan, if they have just Medicare and a supplement, a Part D, they still should be looking at that annually, at least annually, because things change so rapidly, especially with the medications. Like Bruce said, people, the companies get bought and sold, and your costs can go up dramatically without you even knowing about it.
Yeah.
So it's really important to put those drugs in there, get a calculation, look and see if you've had any of your plans change, who they're covering or what services that they're going to provide. We have to be aware of that because it can make a major difference. I do have some people, and you guys know this, that just don't want to change. They don't want to change even if they, could save some money. I understand that. I just want them to be aware of the choices that are out there. They get so overwhelmed with this information that comes in the mail. If you're on one plan, you get it from your plan, but then you get it from 5 other plans. And they almost have paralysis because they're afraid to make a decision. And it's really important to have someone that, and I think we're all this way, that's independent and can just look out for their best interest and really be their advocate to make sure that they've got all the information to make a good decision.
And not making a decision is making a decision.
Yeah.
And I think that they forget that, and you've got to look at especially the drug plans every year, because
Yeah.
it's kind of like the Wild West out there. You never know what's going to happen. So it's really important to look at those every single year.
Now, when you're talking about the drug plans, are you talking about the private sector additions? Or are you talking about the ones that are within the actual Medicare themselves, or all the above?
Yeah, both.
Both.
Okay.
And that can be, well, Part D, if you're on what we call original Medicare and playing alphabet soup, parts A, B, and D, or it could be an Advantage plan too, where you have your drugs built in. So however you take your Medicare, you need to check it every year. And so people now, for their Advantage plans, they're getting a letter or packet about any changes. So it's important that maybe they haven't used everything, and maybe they've used a lot, but it's important to take a look at that and see what a change is, because maybe the change that one company's doing is good for you, or it could be bad for you. So, if it isn't a change that's good for you, then you need to look at another plan.
Right.
So it could have something to do with what your particular situation is too, like what your health situation is, what kind of meds you take, what kind of, treatment you're getting could be very different from plan to plan. Is that what I'm understanding?
Right. And it also is if you are, your health makes a difference too.
Yeah.
If you have a stroke or a heart attack or cancer or something, you may not be able to change plans if you're on original Medicare. You may not be able to change your supplement, and those, if you're on a plan F, they've done away with the plan F. And so those premiums are starting to get pretty expensive. There's every single person's different. Every situation is different. So you really just need somebody to talk to. It's not
you just brought up F.
It's all.
And that,
You just brought
and
up
that should
F.
be,
Go ahead.
oh, I was just gonna say, you really need to talk to them. And that should be somebody besides your friends and relatives.
Absolutely.
People say, oh, my friend's got this and that. I want to do that. Well, it's a different circumstance.
Yep.
Even the TV ads, people call in, I want Joe, I don't know who it is, Montana or Joe Namath, what he's doing. And those ads are quite deceptive.
So your barber's nephew's probably not the best resource?
No.
I can't tell you how many people have come to me and in their mind, they said, I want a supplement. I want an Advantage plan. And I say, that's fine, but I've got to give you the pros and cons. I want to explain both of them. And then they totally changed their mind after 2 hours because they didn't understand the details of either one of them. It happens all the time. But, as you guys said, they look on the TV or their neighbor told them or someone at church said to pick this one. And they just need to have all the facts.
Yeah.
Well, you guys read these things all the time. This is where you guys focus. I know I've had my son read stuff for my mom or what have you, and he owns an insurance agency, but he doesn't do Medicare, and he gets confused trying to read them. So it's he's in the business, but he's not in your aspect of it. So it's really for a layperson that doesn't read, insurance documents. It's not the easiest thing to do, So what I just heard you say that before the open enrollment, you should be looking at these things. So now explain that one to me. I thought maybe you would look at it during that time frame because you got 2 months? Is that correct? Or
You have until December 7th.
okay.
But you can't make a change until then, but it's always good to be prepared. So you're not waiting till the last minute.
Okay.
So that you can look and see what the drug costs are going to be. And then those changes go in effect in January 1st. But you can definitely do it during that time.
So you can do it during the open enrollment, but you can do it beforehand if you already know what
You can look at what your needs are. And you look at that notice that comes out that we talked about, that your current plan, if they're going to have changes that are going to affect you based on your clinical needs, you want to know that, or your drug that may not be covered, because they are sending that to you for you to review that so that you can make a decision for the following year.
I do think people get a little confused about open enrollment too, because if you're on original Medicare, you can change your supplement anytime during the year. It's the Medicare Advantage plans and your Medicare, your Part D, your drug plans that get the open enrollment timeframe. But if you're on a traditional original Medicare, you can change your supplement anytime you want.
Oh, is that right?
Well, but to that point, it's insurance. So you have to, if there's pre-existing, like Colleen said before, a lot of times you can't change.
Right.
So the coverage supplements are the same. Everybody's got the same coverage with, the different letters that we talked about, whether it's a G, but the cost is different.
Right.
And depending on if you have a pre-existing, if you had something happen to you, you may not be able to switch supplements.
That's right. So, and it's really important when you first sign up if you have a pre-existing condition, that you sign up for the best plan for you.
Right. And I always point out in some cases, a lot of it is boils down to a financial decision also, but just what you're comfortable with. I always, I kind of, and I won't go into the whole thing, but I kind of talk to people and compare it to their house insurance. And, they have a high deductible in that. Depending on what kind of plan they choose, they need to be prepared for some out-of-pocket costs. But it is, it's a matter of what they feel comfortable with. Just because you're thinking you need a change, you might not need a change.
Right.
And you're comfortable with what you have, and it seems to be working just fine. then there's no need to change. And all of us in that business, well, look at that and, kind of, do the appropriate thing. So the goal is not to change just for the sake of change. The goal is to change because you're not getting some of the benefits that you need out of your plan, or just a host of other things. But the goal of open enrollment is not to make changes for the sake of changes. It's to make changes if it's appropriate.
And what are you looking for? Is it drugs that you're looking for? Is it treatment situations? What's the main thing that you guys as professionals will be looking for to help that person?
It's both. Based on their clinical needs and what's important to them, you look at that, you look at the different plans. If, there's an average of like 33 different Medicare Advantage, if we're talking about just Medicare Advantage plans, and really looking at what their needs are, what's most important. And when you sit down and talk to them, they usually will articulate what's the most important thing to them. Is it drug cost? Is it, believe it or not, I have some people that a gym membership is very important to them. And so I write it down. You just have to look at all those things. A lot of these companies now give a stipend every quarter. It could go, $70 to $150 that they can go to Walmart and buy their medical supplies. Well, that's a lot of money to them, so they need that, and they look at which plan they could utilize that for. So you really sort of make a list of what their needs are and then try to give them options for plans that meet those needs. And it could be drugs, it could be services. Some of the plans, Jim, now have a home health aide that they'll pay for. So depending on their clinical condition, maybe that's the most important plan for them, that they could get someone in their house for 4 hours a day to help them.
Is that like a short window, or is it like, I know that a lot of times with Medicare, you can get, if someone's in the hospital for X amount of days, they can get home health for X amount of days. I didn't know. Is that what you're talking about? Or are you talking about?
These are Medicare Advantage plans. Some of them have extra services that might be more important to someone than someone else. Someone might need that aid in their home.
Oh, very good. Well, that's interesting. So what if you screw up? What if your plans that you're trying to do, you screw up and you didn't choose wisely? Is that something that's fixable, or is there things that, like, say, if you didn't fix the base plan right, can you ever correct it later? I'm just asking questions here on that kind of stuff. You guys are the experts.
Well, it depends on what's wrong, whether it's fixable or not.
Okay.
Drug plans are fixable once a year. If you have something really bad happen, you had a stroke or a heart attack or cancer or something, you may be stuck in a plan that you can't change. Those are, and like I said, everybody's different. Every situation is different. But yeah, things that happen to you can cause you not to be able to change. Life events.
Mm-hmm. And Jim, there's another open enrollment in January that if you're already in Medicare, like a Medicare with the drug plan, that you can switch, and that goes until like March 31st. So
now what's that one about? I guess I'm missing. I'm not aware of that one.
There's an annual enrollment that we talked about, and then there's an open enrollment, but you have to already be enrolled in a Medicare Advantage plan to take advantage of that.
Of the January one?
Yes.
Okay.
So like Colleen said, there's different circumstances. There's so many that it's hard for us to tell you whether you can change or not.
Okay. Well, I'm trying to figure out, because, I'm sitting here thinking, I truly believe that a couple of my family members have been, I know that they have never talked to a professional on this, in 20 to 25 years. So that, so there could very well be things that need to be addressed, is what I'm hearing here. So, so I know that, I think they're both on, is it, because Colleen, you mentioned F plans. I understood at one time that they really had some really benefits, but it's a shrinking pool. Is that correct? Is that because they're not offering it anymore?
Yes.
And so then that, it's kind of like, it sounded like it had some really great benefits that the other ones do not have, but if it gets to where it's too expensive, is that what challenge might be there where you're going to have a teeter-totter or?
Go ahead, Mona.
Yeah, I was just gonna say, it had the benefit of not having your Part B deductible, that $203. The F didn't have that. But I think what Colleen was referring to earlier is that it is a smaller pool because you can't get it anymore. And as you know, with insurance, you need healthier people to go in there to lower the rates. So some people theoretically say it's going to get more expensive every year because you have a smaller, sicker pool of people and you don't have healthier people coming in that you do with the other types of supplements. So I do have some people that are looking to try to go and move to a G because they are afraid they're going to get in a situation where if they don't move now, they're not going to be because of their health. But
Right.
that's an individual decision. It's still good coverage. It's just some people are just worried about that with it shrinking and not adding healthier people, that the costs are going to go up.
Are you seeing cost increases already? Because I think it was about a couple of years ago I heard about this starting to happen.
Yeah, it started in 2020.
Okay.
January. Mhm.
Yeah. So yeah, the cost, I have seen costs go up. I don't know about you, Mona, but I have seen, if you're on a plan F, your costs are going up. And truly a plan G is a really good plan.
It is.
You know, it's almost exactly like a plan F, only you have a $203 deductible. So, you know, it's not that it's a bad plan. It's a really good plan. So.
And it's the richest, you know, if you can't get an F now, the G is the richest that most people are going to, I would say.
That's right.
So
I'm
let me ask you,
excited. I'm going to be 65 in March. So yes, I'm going to be on Medicare in March. Yes.
well, I'm April, so it's, you know, we're right there. So
Oh,
know.
you guys are both right there. Yeah.
Yeah. So that I'm starting to get the mail, you know, so
And the phone calls and yeah.
Jim, you'll
So-
get a stack like this.
Is that right? I'm gonna be very popular for a while.
Oh yeah. Even my doctor's office asked me if I wanted somebody to call me about Medicare. And I'm like, no, thank you.
Oh my goodness. Really?
It's the first. I've never, ever had that happen to me before.
That's funny.
Yeah.
Oh my goodness.
So let's do this just because, you know, for the people that are watching either live or down the road on a video, could you do me a favor and go through what is the basics of let's just, you know, go back, you know, like Vince Lombardi came to the first practice and said, this is a football. Let's go back to that. What is basic Medicare? What is the alphabet? And let's just kind of make sure that people understand what all those things are.
Well, Part A, we have earned because we have worked all of our lives. And so they're giving that to us for free. And that's your hospital, anything that has to do with the hospital. And then Part B, you're going to pay, I think this year it's $148.50. It'll probably be more than that next year, probably maybe $1 more for us, Jim.
Okay.
And that covers your doctors, any kind of tests you would have, that kind of thing. And then you have Part D, which is your drug plan. And if you are going to stay on original Medicare, you're going to want to get a supplement because Medicare pays about 80% and then your supplement will pick up the balance. And then you have an Advantage plan. So I'm going to let you take the Advantage plan, Mona.
Yeah, Advantage plans are the government years ago decided, hey, they could probably save some money by contracting out with third-party insurance companies, and that would add to their fund. So those plans have grown tremendously. There's now 26 million people in those plans, and they account for about 42% of the coverage right now. And so they've grown 10% over the last couple of years. And some people are expecting that they're going to go up to 51% by year 2030. But essentially, the government, Medicare, will pay these plans to administer the A and B benefits. And then many times they include the Part D into that plan. Not all the time, but they usually have a zero cost to the beneficiary for those plans. And then much like your traditional insurance that you had when you were employed, you would pay a co-payment every time you utilize the services. The nice thing about those plans, they each have benefit supplements and Advantage plans, but the nice thing about those plans is they usually have a cap of anywhere from $3,900, you know, on up of your out-of-pocket expenses. So that is helpful. for the Advantage plans, and then the supplements have advantages of their own.
What about this donut thing that we're hearing about all the time? So can you help me out figuring out what's the best way to minimize it, make it a smaller donut hole, or how do we do all these things? So
I keep hearing the donut hole is going to be disappearing. So I'm crossing my fingers that will happen someday.
okay. So because there's some of us that are early into this, but I do see that I pay my uncle's bills, and I notice a huge difference during part of the year. So
you have the 4 stages. So you have the deductible that you have to pay. It could be $200, it could be $300, and sometimes if it's generic, they don't make you pay a deductible. And then they call it initial coverage, where you're just paying copay for the cost until you get up to. There's an area that you get up to 40, I think it's 4,500. And then you have to get to the 6,505 as your out-of-pocket cost. That's the donut hole. So what you see is at a higher cost, you have a higher cost percentage when you're in that 3rd stage, that donut hole. And so people really try to avoid it. Then once you're past the 6,550 cost out of pocket, you go into what is called catastrophic coverage. And then again, that lowers. So people, they just don't want to get in that donut hole, because then you have to get out of it before it lowers again. And so that's where people really dread it. And probably like your relative, you can see a tremendous, it's up to 25% of the cost of the drug in the donut hole. So that can be really expensive.
Yeah.
is
That's
there
what
ways to
we need
avoid
to-
that, or is it just built into the cake?
No.
If you need the drug, I mean, I
Yeah,
have people say, well, I'm not going to get in there. I said, you have to have this drug.
right.
You can't just not pay for the drug.
Yeah.
Those Part D plans, Jim, the government, I think in their wisdom, thought that they were doing the right thing by negotiating these prices, with the drug company. And that's why they thought everyone should have the Part D coverage, so that they wouldn't have so much out-of-pocket costs. But as we've seen, medications themselves have just gone up tremendously, and it's really stressful for some of these individuals to have that high of a cost per month. You asked what you can do. What I recommend when people are just really stressed about their drug coverage is calling the manufacturer, seeing if they can give them some rebates, seeing if they can give them some coupons. You can also call the state association. Sometimes the state will have a fund that they can help people get those medications when they can't afford it. So there's a couple of different options to try to help with that cost.
Yeah.
In your experience, does it make a big difference as to where they like their pharmacy? Even does that make a big difference? Like, I have been wondering, because 2 of my relatives have the pharmacy that's attached to, that has a contract with the senior living place. And, I just always, and I said that I go into Walmart or to Myers, where you're mine. And it seems like, my drugs are so much cheaper than what they're paying. I just don't know if it makes more sense to just say, hey, you guys quit this, I'll go get them or whatever. So,
Well, I think it depends on which drug plan you choose, because some of the drug plans are associated with pharmacies.
okay.
So if you have a drug plan that's associated with this particular pharmacy, then it might be a lower cost if you go to that pharmacy. It may cost you more if you go to what they consider an out-of-network pharmacy. You may be paying more for those drugs. So that's important when you're looking at your drug plan, to see if you have to. So you put the drug plan, you put your pharmacies in there, and then you can see what your drug would cost at each one of those pharmacies. So it's really important. The drug plans are really important for you to do and for you to look at every year, because you just don't know. Somebody comes in and 2 years later, they're going back out again. So, and they may try to switch you to something else without you ever saying, yeah, that's what I want to do, because that's what they're doing. They're getting out of it and switching you to a different plan. So it's just really important to look at all of that when you're looking for your drug plan.
Which is another reason why people like you guys are necessary, because if this is too confusing.
Well, what we do is we try to look at the meds and then I always ask, what pharmacy do you like? But then I compare 5 other pharmacies.
Yep.
And so just for their benefit, I can say, this is how much you could save by going to another pharmacy. Some people don't want to change. That is perfectly up to them. But at least they have that knowledge that they could save a tremendous amount. Sometimes they don't even know that they're not going to preferred pharmacy within their plan. They really don't.
Absolutely.
And,
Yep,
yeah.
absolutely.
To Colleen's point, you want, especially if they own the pharmacy, well, you want to go to that pharmacy because you're going to get the best benefit.
Right.
That's why you're in that plan. So yeah, Jim, it makes a huge amount of difference on which pharmacy that you use. You can do it yourself. A lot of people struggle to put all the meds in and the generic name versus the non-generic, and then clicking all the buttons, especially if you have quite a few drugs, over 20 medications, it can get a little bit stressful.
I always recommend that people get an account in Medicare.gov, set their stuff up so it becomes easier every year, because here are your list of medications. Well, if you're not taking one, then you can take it off of there. And it just makes it a lot easier for you to compare things every year if you have an account set up.
Okay.
You do. And some people do it themselves, and other people they want us to do it. They just say, you do it. And I have some people that say, I did it myself and I want you to enroll me because I don't want to enroll myself. So it's really up to the individual. Some people don't like technology and it's just very stressful. So I understand that.
Yeah.
Well, I saw that Kathy has put a thing in here. She's looking to schedule an appointment with probably one of you guys to find out more about this. She and I are both, well, and like Colleen, because I know Kathy well, and so we are all in that same boat where we're all going to be some brand new to this. What are the things that what do we need to be paying attention to right now? Because there may be other people besides Kathy and me and you.
Well, you know that you have to sign up for Part B. So you need to go to Social Security, ssa.gov, and sign up so that you can get your Medicare card. And then once you get your Medicare card, then you can go to medicare.gov and set up your account, just so that you have all of that in one place, and you get your EOBs online and all that stuff. So that's what you should be looking at now. And then you can start looking at the different plans and be ready so that you can sign up 3 months prior. And have it all set, so it goes on smoothly when it happens.
So you set up 3 months early is what it comes down to.
You have to call get online to Social Security and sign up for Part B.
So,
Okay.
Jim, your initial enrollment, which is what you're going to be in, is 3 months before the month of your birthday, and then 3 months after. But as Colleen said, you want to sign up before so that you don't have any delay in that Medicare becoming effective. A lot of people wait, and they should not, because we don't know if there's going to be delays, and then that delays your Medicare. So if you're trying to time, retiring or anything like that, it makes a big difference. The sooner, the better. And you have to have that card to be in these plans. So it's really important.
Now, like for instance, for me, I'm supposed to be meeting somebody this week for our company plan. So what happens? I'm going to take advantage of this opportunity. What happens if you have like a company plan and then you got Medicare? Do you switch over? Do you stay with the current, or does it make any difference on timing? Or
I think that's an individual thing too. It depends on how much you're having to pay for your company plan. If it's free, then you might want to stay on it for a little while. And Part A, you're going to get automatically when you turn 65. But you have to sign up for Part B. If you have company insurance, you can delay that, and that's fine. You're not going to get penalized for that. So it just depends. If it has a big deductible, maybe you don't want to stay on that plan. You want to go ahead and get on Medicare, because then you don't have to worry about deductibles or anything like that. But everybody's different. So you just got to look at it and see if it's a better deal for you to go on Medicare, or if it's a better deal for you to stay where you are, because some people still have to pay a lot of money even if they're on their company insurance.
okay, that's why I was just curious what what,
Yeah.
like I said, I'm taking advantage of this opportunity to ask a couple questions that I have, so, but yeah.
And Jim, what I have people do is just write it down and we do a cost comparison. They put it, on 2 sides of paper and say, okay, this is my current plan. And then we cost out whether they want original Medicare and then a supplement and a Part D, or they want a Medicare Advantage. And then they can see in black and white how much it's going to cost for the deductible and how much for the plan. And it makes it a little bit easier and less intimidating, I think, for them to have it all on paper. Because you have to make an educated decision. You don't want to waste money and you want to know what your options are.
Yeah.
I also didn't want to screw something up to where you get penalized because you didn't do something on the right time or what have you. So that's, that was another question. So, and is there a way of screwing that up, or?
Yeah. You need to sign up for Part D when you sign up for Medicare, or you could be penalized forever for the rest of your life if you don't do it right. If you're going to do a traditional original Medicare and then get a Part D, it's important that you sign up for that at the same time.
But if your plan has credible coverage, which is the same as a Part D plan, then you're okay. But you just have to know whether you have credible drug coverage. So.
Okay. So that's something that Medicare has, like here's the answer to that. You have to
Your company, talking to your company HR.
Yeah.
Would be able to tell you that.
Okay.
To verify it.
So now we've got, so basically we're coming up to this time from the 15th of October to the December 7th. I assume that you guys become extraordinarily hard to get a hold of, during that time frame. So what's it like is I'm going to be a customer. I'm going to come to you. Tell me what my experience is going to be. What are you going to do? What's that appointment going to be like? How much prep work do I have to do? I'm just kind of, people watching this, what are we going to experience when we call somebody that's a professional like yourselves?
Well, we're going to sit down with you, and it's probably not going to be a 20-minute conversation. It's probably going to be an hour, 2 hours, depending, everybody, like I said, everybody's different, but, we're going to look at your medications. We're going to look at your health. We're going to look at your budget. There's a lot of different pieces that you want to have. You want to have all your medications, or a list of medications, and you want to know what your budget is. Some people need to go on an Advantage plan because they don't have money to spend on a supplement. So that's all those things are important, and your lifestyle, and do you want a gym membership? It's really funny to me how important that is to some people. To have that gym membership. It's like, I only want this program if I'm going to get a gym membership. And it's just really funny to me. But it's really important to some people, so, we have to go through it all and understand who you are and your lifestyle and your budget and all of that kind of stuff, and your health. All those things are important when you make that first decision.
And I think, everybody is different. So some people know exactly what they want. And I can still go through the positives and the negatives of each, but they just know, and other people just take a lot of time, and they might ask and email me 10 times before they feel comfortable. It's a big decision.
Yeah, it is.
And, to Colleen's point, you can't do it in 20 minutes. Medicare can be confusing. And sometimes I will literally say the same thing about 4 or 5 times before they get it. And that's totally acceptable, because it's overwhelming. They're writing down everything, and you just have to, restate things constantly so that they can make a good decision. There's no right or wrong. I spend as much time as possible, as much as they need. Some people are quicker than others. They've already done their research online. They've already, talked to their spouse and their family, and other people, well, they have questions for weeks.
Yeah.
So everybody's different, but the good thing hopefully about us is that, we're there to answer those questions as they come up, whenever they come up.
Right.
So if let's say, for instance, you made the comment somebody might want to go on an Advantage because they can't afford the premiums or what have you. Let's say they do that, and then ultimately that's not their best thing. Can they then go, oops, my bad, then jump back to the other kind of program, or are you kind of locked in once you've made some of these choices?
Well, yes and no.
That's what I was asking. Yes. So I had this funny feeling. Yes. Yeah.
If you have been on an Advantage plan for a whole year, then you still have to medically qualify to go to a traditional supplement. So you could go back onto a traditional supplement with A and B. You can go from a traditional supplement to an Advantage plan anytime.
Okay.
You don't have to medically qualify to do that. But to go the other way, you do have to medically qualify. So, but if you make a mistake in that first year and you say, oh, I think I don't want to do this, you can go to the other plan with they have to accept you. So you don't have to medically qualify. So if you make a mistake in that first 12 months, that's rectified. You can rectify that.
Jim, the only time that you don't have to go through that
So you get one mulligan?
medical, yeah, the only time you don't have to go through the medical is when you're first enrolling for a supplement.
Yeah.
So then they don't make you go through the pre-qualifying, they can't disqualify you. But anytime after that first year, you're going to have to go through underwriting. So if you have a medical event that you can't control, they can deny you, but not in your initial period.
Right.
So that's really important that people understand that. You can always go down from a supplement, but you can't go from a Medicare Advantage to a supplement without going through underwriting. It's really important for people to know that. Only time that they can not go through underwriting is your initial, that period that we were talking about, that initial period of signing up.
I feel like it's really important that initial period that you sign up for, that we know everything. We know if you have diabetes, we know if you have heart issues, even though Medicare has to accept you no matter what. It's important to know that, to know if you go onto an Advantage plan and you do have all of these issues, then you aren't going to probably be able to switch onto a traditional supplement. So it's really important that we know everything, so that we can tell you the best options in our opinion.
Well, that's important. So basically you get a 12-month or a first 12-month mulligan. I screwed up, so I just have to go back to this other one, and it didn't happen, so whatever, right? So that's good. So because a lot of us will screw up, I'm sure. So well, that's really, so tell me, again, they come to you. So what would you like to tell people that are going through this process? They're coming up to this open enrollment. Maybe they're like some of my relatives that have never even really, they've looked at them and they finally go, well, okay, I'm going to just, roll the dice and stay with where I'm at, or what have you. What would you like to get people to understand that we haven't covered?
I just think every year you should do a benefit review. You should look at where you are and what drugs you're taking, how your health is, what price you're paying for your supplement, or you're on an Advantage plan or whatever it is. But you need to look at it every year, at least once a year.
I agree. And I think you need to understand your coverage. People don't, as I said before, they don't even utilize what they currently have. And you really need to go through your booklets, whether it's online or whether it's in your hand, to understand what your plan is currently offering, because there's benefits that are added, that you may not be aware of, that they've sent you in the mail, and just to really be complete and go through that coverage so that you can make an educated decision and utilize everything that they have. I mean, it's awful if you get $150 every 3 months and you're not utilizing that for your medical supplies. It's awful if you can get free meals, after from 10 days, but you didn't know that you could get that. Those benefits are in there. Or they increase your dental, to, from 1,000 to 2,500 so that you can get your crowns. All that stuff changes. It really does. And you have to be aware of it before you can make a decision. So I want people to know that, just understand what they currently have, because sometimes when I explain it to them, their eyes light up and they are like, I never knew that I had that.
So that's basically part of what you're doing, is literally going through all their stuff and trying to read and decipher all this stuff that's going over their heads.
Some people understand it. Not everybody, but some people know exactly what they have. Other people, they don't. Yeah. And just trying to have them make an educated decision to understand what their current benefits are. I had one lady that said, I wanted the silver sneakers. She already had silver sneakers in her plan.
Oh, really?
Yeah. So, I mean, this happens all the time. Yeah.
So do you now working with you guys, do people come to your office or do you go to their home, or how does all that work? Do you do it on Zoom? I mean, what's the format?
All of the above.
Okay. Which is the most comfortable for most people? For you, if you had an opportunity to say this is ideal, what do you prefer people do for you?
I guess I feel like right now with, with all of the COVID stuff going on, a lot of people don't really want you in their home. But some people really do want you in their home. So I think it's just really, another one of those, a personal preference. I'm fine going into people's homes. I'm fine doing it on Zoom. Whatever the client wants, I'm fine doing. So I have no issues of going into their homes, but a lot of people don't really want you in their home. So you can come to me, or I can come to you, or we can do a Zoom call.
Okay.
And sometimes, I have clients that want to meet at McAllister's or, somewhere near to them, and that's fine. I will say I have done more over the phone, with Zoom and explaining the benefits and then sending it to them, to sign. So
Do you have them, if you're going to do it on Zoom or what have you, do you have them like mail you a copy of their thing, or how do you look over all their stuff so you can tell them what they got?
they could, yeah. Those are usually people I meet in person.
I was going to say, I would think so.
That's pretty hard to do that.
Yeah,
on Zoom.
but Colleen knows this, the technology now is amazing where they can sign everything. They can text a signature. You just press a button, you fill out their application, just say it's coming to you, just sign it. The technology in signing up for these plans is amazing.
It is.
Well, I get that part. What I was talking about was I just saw my uncle's packet, it's like
I do that in person. I haven't had anyone fax.
Yeah.
No, that's too hard to not do that in person.
But that's what a lot of the value that you guys bring is to go through there and help people understand what they've got and what they need to be doing too. So that's why I was just curious how that worked.
Yeah.
So where are you guys located? I just see that from Kathy. So
Oh, I'm in Carmel, but I travel all over.
Me too.
both Carmel. Okay.
Yeah.
So yeah. When I send this video out, I'll put your contact information on there and all that kind of stuff too, so people can find you. So Kathy, do you have any questions that we aren't covering? I just, so you've had a couple here. So, but I said, I'm really excited about this one. I think that we've really covered some really good ground here, because this is an area I know from personal experience. I know I don't understand it. And I know that my family has just basically kind of gone along to get along type thing with stuff. So we obviously will have to address that. I just was talking to my uncle the other day saying that I want to get someone into his place to take a look at all that packet of stuff and figure out where he's at and if it's the right place, if he's in the right situation. So I really want to thank you guys for being here. I don't know if there's some other things you would like to talk about. We can cover those. We don't have to do a full hour. So it's kind of like, if there's anything you guys else want, is there anything, Kathy, is there anything you want? So I don't see any response yet. So, well, guys, thank you for coming. We'll get this promoted out. I will put your contact information in here so people could find you. I was so glad that we actually was able to do this in a timely manner, because I'm always doing this when it's not during open enrollment. So now here we are, it's right before the thing starts. So it's a perfect setup. So
It's great timing for everybody.
That's what I'm and like I said, I'm excited. So, and I've learned things, and we'll get this thing out to people. So thank you very much for being here. So, and take care of yourselves. We were having too many people falling apart on this.
You know, right?
Yeah.
So,
Yeah. Everyone stay healthy out there. And just one takeaway is just, do that education, look at your plan at least once a year and realize what you need.
Right.
Perfect. And we need to go over to Colleen's and hang out at her place, because I've been looking at the beach running all day today. So
it's where I want to be.
For the next few months, you're not going anywhere. So
No, I'm not.
Okay. I'll talk to you guys. Take care.
Bye-bye.
Bye-bye.